So the fallopian tubes are really important. They're like a carriageway connecting the semen and the egg, and in the tubes fertilization occurs, and then the embryo is transported into the uterine cavity or the endometrium for implantation. So if you've got a tube which is diseased, the egg and the sperm may never meet, or if they meet, they may actually cause an ectopic pregnancy, a pregnancy within the fallopian tube again, which is non-viable, and the patient might present as an emergency. And also, if they've got a damaged tube and it's got fluid in it, and if by chance implantation did occur, then later on the fluid from that tube may seep into the endometrial cavity and cause a miscarriage. So essentially, tubal disease is not very useful or good in patients who want to get pregnant, and there may be a few things that we do for that, including removal of the tube, because if the tube is damaged, then actually removing it reduces their risk of tubal ovarian abscess, ectopic pregnancies, a miscarriage as well. And the same is true if the patient's got really badly diseased bilateral tubes. Now, it might not make sense to actually removal of my tubes. Well, how am I going to get pregnant? If the patient's been trying to get pregnant for a number of years and they've got bilateral tubal disease, it may be that they can't get pregnant naturally, and so they're relying on IVF. And then IVF success rate would be determined by the tubal disease. So if the patient went to fertility and had IVF, if they've got tubal disease and you remove the tubes, you actually improve their chances of IVF success by more than 50%. So although it might seem counterproductive, there are numbers, data and science behind the logic of how we manage these patients. And again, each patient's specific. So one tubal disease might not be similar to another patient. So we'd have to take the holistic, thorough investigation of each and every patient.